Hello everyone. In today's video, we'll be going through often repeated questions on the physiology of the heart. So the first question goes like this. The pacemaker of the heart is, we have A, the AV node, B, the Purkinje's fibers, C, the SA node, and D, the bundle of His. So our answer here is actually C, the SA node. The SA nodes actually initiate the electrical impulses that set the rhythm for the heart, which is actually the function of the pacemaker. So question number 2, which of the following valves prevents the backflow from the aorta to the left ventricle? We have A, the mitral valve, B, the tricuspid valve, C, the pulmonary valve, and D, the aortic valve. The answer is D, the aortic valve. The aortic valve actually prevents the backflow of blood from the aorta into the left ventricle during diastole. Question number 3. During which phase of the cardiac cycle does ventricular filling occur? We have A, isovolumetric contraction, B, ventricular ejection, D, isovolumetric relaxation, and D, diastole. The answer here is D, diastole, because ventricular filling occurs during diastole when the ventricles are relaxed and the AV valves are also open. Question number 4. The first sound, the S1, is caused by, for the options we have A, the opening of the semilunar valves, B, closure of the AV valves, C, closure of the semilunar valves, and D, opening of the AV valves. The answer is actually B, which is closing of the AV valve. Now the S1 is produced by the closing of the mitral and the tricuspid valves at the beginning of systole. So question number 5, which of the following ions is most important for the plateau phase of the cardiac action potential? We have A, sodium, B, calcium, C, potassium, and D, chloride. The answer is actually calcium, because calcium influx through the L-type channels maintains the plateau phase, which is the phase 2 in the ventricular myocytes. Question number 6 is, the cardiac output is the product of, we have A, the heart rate and ejection fraction, B, heart rate and stroke volume, C, stroke volume and end diastole volume, and D, systolic and diastolic pressure. The answer is B, heart rate and stroke volume. And this is because the cardiac output is simply equals to the heart rate multiplied by the stroke volume. Question number 7. Which structure conducts impulses from the atria to the ventricle? We have A, the AV node, B, the SA node, C, the Purkinje's fiber, and D, the bundle of branches. The answer is actually A, the AV node. Now the AV node delays the impulses and it passes it from the atria to the ventricles. Question number 8. The Frank-Sterling law describes the relationship between, for the options we have A, stroke volume and arterial pressure, B, end diastole volume and stroke volume, C, heart rate and contractility, and D, cardiac output and systemic resistance. The answer is B, which is the end diastolic volume and the stroke volume. Now the Frank-Sterling's mechanism states that the heart pumps more forcefully with increased preload. Now question number 9. Which of the following increases heart rate? We have A, the vagus nerve stimulation, B, acetylcholine, C, beta adrenergic stimulation, and D, calcium channel blockers. The answer is C, which is the beta adrenergic stimulation. The beta 1 stimulation, such as epinephrine, actually increases heart rate and contractility. Question number 10. The second heart sound, which is the S2, corresponds with, we have talked about the first sound, which is the S1. Now this question is about the S2. The options are, we have A, opening of the AV valves, B, closure of the semilunar valves, C, contraction of the atria, and D, ejection of blood into the great vessel. The answer here is actually B, which is the closure of the semilunar valves. The S2 actually marks the end of systole, and it's caused by the closure of the aortic and the pulmonary valves. Now let's move over to question number 11. It goes like this: which components of the ECG corresponds to ventricular depolarization? We have A, the P valve, B, the T valve, C, the PR interval, and D, the QRS complex. The answer is actually the QRS complex. The QRS complex represents depolarization of the ventricles, which triggers ventricular contraction. So question number 12. What happens during isovolumetric contraction phase of the cardiac cycle? We have A, all valves are open, B, AV valves are open, C, all valves are closed, and D, semilunar valves are open. The answer is actually C, all valves are closed, because during isovolumetric contraction, the ventricles contract with both the AV and the semilunar valves closed. So it actually increases pressure without volume change. Now question number 12. Which chamber of the heart generates the highest pressure? We have A, the right atrium, B, the right ventricle, C, the left atrium, and D, the left ventricle. The answer here is actually D, the left ventricle. The left ventricle must pump blood through the left ventricle must pump blood through the high resistance systemic circulation, so it actually generates the highest pressure. Question number 14. What does the PR interval on the ECG represent? We have A, the atrial repolarization. We have A, the atrial repolarization. B, time between the ventricular depolarization and repolarization. C, time from atrial depolarization to ventricular depolarization. And D, duration of the T valve. The answer here is actually C, which is time from atrial depolarization to ventricular depolarization. The PR interval actually measures the time the impulse takes to travel from the SA node to the ventricles. So question number 15. What effect does the parasympathetic stimulation have on the heart? We have A, increased heart rate. We have B, decreased heart rate. C, increases contractility, and D, delays polarization. The answer here is actually B, which is decreased heart rate. Here the parasympathetic impulse via the vagus nerve actually slows the heart rate by acting on the SA and the AV node, which is unlike the sympathetic stimulation. Now question number 16. What is the normal pacemaker rate of the SA node? We have A, 20 to 40 BPM, B, 40 to 60 BPM, C, 60 to 100, and D, 100 to 120. The answer is actually C, which is 60 to 100 BPM. The SA node sets the normal sinus rhythm between the 60 to 100 beats per minute. Now question number 17. The stroke volume increases when we have A, afterload increases, B, preload increases, C, heart rate increases, and D, venous return decreases. The answer is actually B, the preload increases. So according to the Frank-Stelling's law, which I've talked before, greater preload, which is the venous return, stretches the heart and increases stroke volume. Question number 18. Which part of the conduction system delays the impulse to allow ventricular filling? We have A, the SA node, B, the AV node, C, the Purkinje's fibers, and D, the bundle of His. The answer is actually the AV node. The AV node actually delays the impulse briefly so the atrial can contract and fill the ventricles before they contract. Question number 19. Increased afterload will typically result in, we have A, increased stroke volume, B, decreased stroke volume, C, increased preload, and D, decreased end systole volume. The answer is actually B, decreased stroke volume, because higher payload makes it harder for the ventricles to eject blood, and this reduces the stroke volume. Question number 20. Which ion primarily is responsible for depolarization phase in pacemaker cells? We have A, potassium, B, calcium, C, sodium, and D, chlorine. The answer is actually B, which is calcium. In pacemaker cells, calcium influx through the L-type channel causes depolarization. So there you have it, question 1 to 20 on recurring questions on the cardiovascular system. If you like this video, please don't forget to give it a thumbs up and also subscribe for more contents like this. See you in the next one.